Hello, my name is Dr. Mike Holland, and I'm going to provide a brief overview of our report, The Health Impacts of Coal-Fired Power Stations in the Balkans. I'm an environmental consultant working from the UK. I have worked for over 30 years on the health and environmental impacts of air pollution for national government in, for example, the UK, Sweden and France, for international bodies such as the European Commission, the OECD and the World Health Organization, and for a number of private companies and NGOs such as the Health Environment Alliance. My work for the European Commission includes the cost-benefit analysis of the recent Clean Air Policy package. I have direct experience in the Balkans and work for the European Commission, the World Bank, and in several studies where HEAL has played a role. The methods used in our report have been developed in analysis for the European Commission and the European Environment Agency. Their development has involved consultation and agreement with a large number of experts from both Europe and North America over many years, dating back to the early 2000s. The methods are broadly consistent with those adopted in other major studies around the world, for example by the US Environmental Protection Agency and WHO's Global Burden of Disease report. The methods are based on the extensive epidemiology literature on air pollution and health that has emerged over the last 25 years. Several thousand peer-reviewed papers have been published demonstrating that air pollution, especially in the form of fine particles otherwise known as PM2.5 or PM10, damages health. Some of these particles are emitted directly into the atmosphere from power generation and other sources such as transport, while some particles are formed in the atmosphere following the release of other combustion pollutants, especially sulfur dioxide and oxides of nitrogen. A wide range of health impacts have been linked to air pollution exposure, ranging from mortality and cardiovascular hospital admissions down to worsening of asthma and other sickness, leading, for example, to absence from work. A recent review that I've been involved with the Royal College of Physicians and the Royal College of Paediatrics and Child Health in the UK charts out these effects over the life course from conception to death. I must stress that there's no evidence of a threshold for effects of most air pollutants on health at the level of the population. Good evidence for health impacts of air pollution has been found even in areas subject to very low levels of air pollution, such as most of Canada. This has two important consequences. First, that the conclusion from a typical environmental impact assessment of a power station project that the plant in question would not lead to a breach of some air quality standard does not mean that the plant has no impact on health. Secondly, the impacts of air pollution should be assessed over a long range, extending to 1,000 kilometres or more. Turning now to the results, the report expresses health impacts in two ways, in terms of the size of impacts on mortality and in terms of the monetary equivalent of those impacts. The methods for valuation of impacts account for lost productivity, healthcare costs, and loss of what economists refer to as amenity, in this case the willingness to pay not to suffer ill health and the pain and suffering that it brings. The report estimates that emissions from the Balkan power stations account for 7,700 deaths each year, assuming all power stations operate to current or planned capacity. Most of these deaths are linked to emissions from the existing stock of power stations because many of them lack modern emission controls. These impacts on mortality and other impacts on morbidity have together been valued at over €3 billion per year, with values adjusted to take account of economic conditions in the Balkans. Approximately 40% of those impacts occur within the 5 Balkan countries considered in the report, with the remaining 60% occurring in other European countries. Of course, reduced emissions in other countries through the adoption of tighter emission standards and a strong shift away from coal-fired generation have brought benefit to the Balkans already, and will increasingly do so in the coming years as further emission cuts are made. In conclusion, the results demonstrate that even after the adoption of much improved emission standards for power stations, emissions will continue to damage health. Impacts will include mortality, hospital admissions, chronic bronchitis, and a number of other effects, not all of which have been quantified. Given that the life expectancy of a power plant will be 40 years and more, noting that some power stations in the region date back to the 50s and 60s, these impacts will persist for many years to come should proposed power stations enter operation. These impacts need to be considered during the development of energy policy across the Balkan region. Thank you.